Hi, I'm going to answer the questions from Shayna, Lauren Williams, and Shannon. I'm sorry if I'm saying your names wrong. You guys asked me a bunch of questions about the NCLEX, what I did in college to stay grounded, and about my study habits. So I want to go over some of that stuff with you. As far as what I did in college to stay grounded, I try to make time to study every day. Were my study habits the best? Absolutely not. No. I went to a fun school. I had a good time, but I think that helped. It helped me maintain a little bit of a balance. I knew that if I got done reading my 4 chapters that I could go out. So that helped a little bit. I loved note cards. That was the best thing in the world for me. I mean, my roommate probably thought I was crazy. I had them on the ceilings, on the walls, on the doors. They were in every purse I owned, but that's what worked for me personally. So you need to find out what works for you and stick with it. I wouldn't tell you to, study in a group. Sometimes that's not the best, but it depends on your personal study habits. But always take notes in class. I know those lectures are terrible and you want to just run out the room screaming, but you really need to pay attention in class, take notes, and review those notes when you get home, because those things will stick in your mind and they will be on that test most likely. As far as the NCLEX goes, that is the most dreaded test for most nurses or new grads. It's scary. You're ready to get your money. You're ready to start working in the hospital. You're ready to get your first job. So there's all these emotions, and it's really, really expensive. So what I would say is do something that is guaranteed that you're going to pass. Kaplan offers a really good class. There's Hertz Review. There's a lot of different review courses, and they can kind of map out a study plan of that test for you. That test is very, very difficult. It was for me personally. I hear people say it wasn't that hard, but for me, I thought it was difficult. I swear by, just organized studying. The test, what a lot of people will tell you is to do a lot of questions so you can get a feel for sitting down for that long. When I took the NCLEX, I got 265 questions. 265 questions. And I passed with 265 questions. But had I not sat with Kaplan and reviewed and went over all that information, it would have been much more difficult. As far as, your first job as a nurse, you're going to feel unprepared. You're going to be scared. It's difficult. It's something totally out of your element that you've never really done before. You've taken care of patients. You may have worked as an extern or an intern, but it's different than anything that you've done. It's a whole different ballgame for you now. I started working in med-surg. Do I think that it helped me? Tremendously. Because med-surg patients are a little bit less critical than those in the ICU, so you can get used to taking care of those type of patients. So I think it's a good fundamental stepping stone to start with med-surg, or even a lower level of care than med-surg. As far as another suggestion for your first job, I would say to take an externship or internship at a hospital, or even volunteer at a hospital. It'll make your shock not so difficult when you get out of school. So that's my advice for you. Continue to subscribe with me. Talk to you guys later.